If you've been dealing with leg pain or sciatica and you've stretched, strengthened, and followed YouTube videos for months now with no real relief, this might be a hard thing to hear. The stretches, the exercise, they're probably not the problem. I'm Dr. Chris Cameron. I'm a chiropractor in Lucan, Ontario. And for the last 25 years, we've helped thousands of people suffering with lower back pain, disc herniations, and nerve pain, many of whom were told there's nothing that could be done. In fact, in 2025, 77% of our patients felt at least a 50% better using our unique treatment approach. Here's the truth that no one really covers. If a bulging or herniated disc is still crushing that nerve root, no amount of exercise, no amount of stretching will fix it. In this video, I'm going to share with you 3 things. How to tell if your leg pain is actually coming from a disc issue or a nerve issue, what most exams completely miss, and the exact step-by-step BackStrong protocol we use to take pressure off the nerve, heal the disc, and help people get back to their normal everyday life without drugs, injections, or surgery. You'll also hear about a patient we've helped, Anita, who came to our office who could barely be able to walk, sleep. Everything was tough for her. Numbness and tingling were shooting down her legs. And more importantly, how she got more than 50% better in 6 weeks. Stick with me, because by the end of this video, you'll know whether you're missing the real cause of your pain and what to do next. Most people are told their leg pain comes from the tight muscles, the weak hips, or just getting older. That sounds logical, but in many cases, it's completely missing what's actually caused the problem. The sciatica, that persistent leg pain, usually starts in the spine, not in the leg itself. When the spinal disc bulges or herniates, it can press on a nerve root, most commonly L4, 5, or S1. Those nerves don't stop in the back. They travel through the pelvis, form the sciatic nerve, and run all the way down the leg into the foot and toes. That's why the pain feels like it's sharp, it's burning, electric, or like pins and needles. And also why stretching the leg rarely fixes the cause of the problem. Here's what confuses most people. The leg hurts more than the back, so they chase the pain instead of the source. But as long as that nerve stays irritated, compressed, the pain signals keep firing no matter how many exercises, no matter how many stretches you do. And this leads to the next major problem. Even when people seek help, most exams never clearly identify where the nerve pressure is actually coming from. Most people assume that once they've been examined, the cause of their leg pain should be clear. But in many cases, the exam focuses almost entirely on where the pain is felt, not where it's coming from. Because the pain is in the leg, treatment is often directed at the leg. That's why so many people are prescribed pain medications or nerve drugs like gabapentin. These can quiet the signal temporarily, but they don't remove the pressure on the nerve root that's creating the pain in the first place. In other cases, people are given exercises or injections without clearly confirming which nerve is involved or why it's irritated. Findings from an exam may be discussed, but they're not always connected to the symptoms in a meaningful way. So patients do everything they're told and still don't understand why nothing is getting better. Here's a key point. Until the exam clearly identifies where the nerve is being compressed and what's causing the compression, treatment is focused on a symptom or symptom control and not correction. And that's why so many people stay stuck. The real question isn't whether your pain is in the leg, it's whether the disc in your lower back is putting pressure on the nerve, creating that pain you feel down the leg. When the disc bulges or herniates, it narrows the space around the spinal nerve root. This pressure changes how the nerve functions and the pain is perceived in the leg. That's why disc and nerve problems almost always show up together. There are a few strong clues that the pain in your leg may be coming from a disc in your back. Pain that travels down past the knee. Numbness or tingling, burning sensations, weakness, or a sense that the leg might give out are all key signs. Pain that is worse when sitting, driving, bending, or first thing in the morning almost always fit the pattern of a disc problem. Another important clue is pain that is persistent. Muscle pain usually improves within weeks. Disc-related or nerve compression often lingers for months, even when you're stretching, exercise, and taking medication. When the pain stays for months, that's telling you a key indicator. The pressure on the nerve hasn't been relieved. And when that pressure remains, the problem isn't a lack of exercise, it's unresolved disc pressure affecting the nerve. When disc pressure is still affecting the nerve, exercise alone will rarely be enough. Strengthening and stretching can help after the nerve is calm, but they don't create space inside the spine to take pressure off that compressed nerve. This is where so many people get stuck. They're given a few exercises, maybe some hands-on care or a short burst of relief, but nothing is done to address the disc itself. As long as the disc keeps pressing on the nerve, symptoms keep coming back. The same thing happens with a single form of treatment. An adjustment by itself, an injection by itself, medication by itself. These may reduce pain temporarily, but they don't change the mechanics that caused the problem in the first place. Lasting improvement usually requires a sequence, a multimodal approach. First, reduce the pressure on the nerve. Then, restore the healthy movement of the spine. Only after that does strengthening protect for a long-term basis. When these steps are out of order or missing, people stay trapped in short-term relief and long-term frustration. Disc and nerve compression problems rarely improve with a single type of treatment. That's why we don't use isolated therapies. We use a multimodal system called the BackStrong protocol. The goal is simple. First, reduce the pressure on the nerve. Second, restore healthy movement of the spine. Third, build support so the disc doesn't keep getting irritated. Each step is timed and layered so the body can actually heal without constantly flaring up. This isn't guesswork. Every plan is guided by a thorough exam, imaging, so that we can exactly know what level is involved and how your spine is responding. This will allow treatment to be specific, gentle, and progressive. When these steps are combined in the right order, people stop chasing relief and start seeing real, measurable change. Here's the mistake most people make with a disc and nerve issue. They try one thing at a time, in no particular order, and hope it sticks. But when the goal is reducing the disc pressure and calming the irritated nerve, sequence matters. That's why the BackStrong protocol is built as a step-by-step system. Step 1, warm up, just like going to the gym. This prepares the lower back and the surrounding muscles of the spine so it can accept the treatment without guarding. 2 is laser therapy. We use class 4 robotic laser therapy to reduce inflammation and improve blood flow to the damaged tissue. Step 3, computerized non-surgical spinal decompression. This gently creates a negative pressure so the bulging material can retract away from the nerve. Step 4, chiropractic care. Once pressure is reduced, we restore healthy movement to the spine. Step 5, the back mats belt. This prolongs the effects of the decompression and stabilizes the spine between visits to protect the corrections we've made. Step 6, customized nutrition and supplementation. Healing slows when inflammation is high. A bad diet or lack of proper nutrients can accelerate this. And step 7, customized rehabilitation. This is where strengthening finally makes sense after the nerve has calmed down. Step 8, custom orthotics, when needed. If the foundation of the spine, the feet, is out, then the spine will pay the price. Each step has a job, Each step supports the next. And when they're combined properly, you stop guessing and give the disc and nerve the environment they need to recover. Let me show you what this looks like in real life. Anita came into our office needing help from her husband just to walk. She had shooting leg pain, numbness, and tingling that made it hard to sit, sleep, or get through a normal day. She had already tried exercises, medication, and other forms of healthcare, but nothing had shown improvement. After a third exam, we found disc pressure affecting a nerve, and she started the BackStrong protocol. Within 6 weeks, Anita reported more than a 50% improvement, and she was off of all of her pain medication. She was sleeping through the night again, moving with less fear, getting her independence back. Stories like Anita, they aren't rare when the disc pressure and nerve irritation are properly addressed. Healing doesn't happen in an instant, and it is not identical for everyone. What matters most is consistent, measurable progress. In our clinic, 77% of patients report at least a 50% improvement by the end of their third month, and many continue improving beyond that. The biggest factor is follow through. Healing a disc isn't a quick fix. It's about giving your body the best chance to heal and stay strong. If leg pain or sciatica has been limiting your life, the most important step is getting clear answers. That means an exam that looks for disc pressure and nerve involvement, not just where it hurts. When you understand the source of the problem, your options become much clearer. You may not need surgery or injections, and you may not need to stay on medication for the rest of your life. Many people simply need the right plan in the right order with proper guidance. The goal shouldn't be just pain relief. It's getting back to walking, sleeping, driving, and living without constantly fearing that pain in your leg. If this video helped you understand your condition better, like and share it so it can reach someone else who might be struggling in silence with the same problem. And I'd love to hear from you. Comment down below and tell me what you've been dealing with, what has helped, and what has not helped. Go ahead and make sure to subscribe so you don't miss future videos on strengthening your spine and getting back to an active, fulfilling life. The next video you should watch is Say Goodbye to Sciatica, 3 steps when nothing else works.